and warm welcome to all the invited guests, KMA leaders, and members. Let us begin this 19th edition of the KMA Leader Talks session with a minute's silence and pray to Almighty that we all remain safe and healthy and all of us overcome these challenging times. Continue to be seated wherever you are and close your eyes for a minute. Thank you and good evening once again to our guest of the evening, Mr. Tirupathi Karthik, CEO of Napier Healthcare Solutions Singapore, past President and Program Committee Chair, Mr. S.R. Nair, past President, Mr. Raj Mohan Nair, Senior Vice President, Ms. Nirmala Lilly, Joint Secretary of KMA, Mr. Aljas Khalid, other managing committee members, members of KMA and other LMAs, students and invited guests. We have a very topical subject for the session today. While we are hearing a lot about disruptions, innovations, and new normals being spoken about during these COVID times in almost all domains of business. As the topic for the day says, innovations in COVID times with special focus on healthcare. We have an expert from the healthcare business to address us today on the new innovations propelled by the pandemic. Well, this is how KMA has been pulling on in these troubled times to keep our members engaged, remain positive, and provide with meaningful deliberations and events of utility. Situation around us is slowly limping back to some kind of sanity, yet uncertainty looms large on many aspects of our day-to-day life and business. Adding to the turmoil is a new threat on a daily basis regarding the unprecedented heavy rainfalls and the related threats from our frequent visitor, that's the floods of Kerala. In spite of all the troubles and turmoil of the pandemic, KMA has been continuously bringing to you very many events of purpose on a regular basis. StartCon discussion series presenting successful startup companies featuring 20 such individuals who are making it big with their startup ideas. Very meaningful and focused women managers forum activities at least once a month, enriching sessions exclusively for the MSMEs, and many management education programs we were trying to serve suiting everyone's palate. We even conducted a week-long management week celebrations during February, a management students convention with over 800 B school students participating in it, three memorial lectures with exceptional speakers, organized a virtual run, the KMA run with nearly 1,000 participants from across the country propagating our theme of responsible management, and also conducted one digital summit in hybrid format. All three memorial lectures of KMA, that is a Professor M.V. Paili Memorial, Professor K.T. Chandi Memorial, and Sri M.K.K. Nair Memorial lectures were conducted with some of the finest speakers addressing our delegates. In addition to this, we have started a series of workshops for the MSME sector with an opening meet that was inaugurated by the State Industries Minister, Mr. P. Rajiv himself, and continuing with specific workshops enlightening the participants on various schemes, benefits, and offers available with central, state, and banking institutions. We thereafter had the first of such workshops on central government schemes, where we have had the State Industries Principal Secretary, Mr. Mohammad Hanish, and Joint Director from the Ministry of MSME, Government of India, Mr. G.S. Prakash, addressing the delegates. We had the second in the series of workshops last month when Mr. S. Hari Kishore, IAS, Director of Industries and Commerce Department, Government of Kerala, interacting with our MSME members on the state government schemes and policies available for the segment. We also initiated a new event titled Rendezvous with the CEO, a program organized by the KMA CEO Forum, which features an interactive session with CEOs of national repute who have made significant and remarkable achievements against all odds to share their success stories with our members. We have had two such events till now with Mr. Kishore Romta CMD of FACT Limited, and Mr. Dilip Umman, CEO of ArcelorMittal Nippon Steel India, coming in to address our delegates. Well, coming into today's Leader Talk sessions, our program committee headed by past president and corporate mentor S.R. Nair and our team have been conceiving regular programs under the banner of KMA Leader Talks. We have presented a series of such lectures of eminent personalities, and this is the 19th of the Leader Talks lecture series that we are having in this KMA year. All these sessions were carefully selected with the renowned speakers from the industry and academia, sharing their domain knowledge and their invaluable experience with our audience. Speakers were from diverse sectors and topics were topical and timely. And today, we have yet another session with contemporary relevance and great level of interest to all. Necessity has been the mother of invention in the response to the COVID-19 pandemic, triggering many an innovation, often without the luxury of time to test these makeshift solutions to pressing problems. But there is much to be learned from times of crisis for times of plenty. COVID-19 has required unprecedented responses from all the countries. Such has been the speed and severity of the pandemic that few countries have been afforded the luxury of following traditional processes of testing and trialing new technologies, processes, or even medicines. The lack of time and resources available to respond to the crisis, as well as the need for rapid scaling in every context, has led to an explosion of innovative responses. In the healthcare business, in that segment, these innovations happen not only in inventing new remedies and concoctions to cure illnesses, but also to transform businesses of hospitals, clinics, and even long-term care and home care. It remains to be seen whether this global crisis will permanently disrupt how innovations occur in healthcare. In recent years, healthcare innovators have brought us artificial intelligence algorithms, inexpensive genomic sequencing, and vast improvements in health management through big data analytics, to name just a few examples. While the COVID-19 pandemic has placed unparalleled demands on modern healthcare systems, the industry's response has vividly demonstrated its resilience and ability to bring innovations to market quickly. And we have with us today a leader who is part of spearheading one such business house which is continuously innovating to enable and support the healthcare segment. We have Mr. Tirupathi Karthik, CEO of Napier Healthcare Solutions Singapore, to address us on this interesting topic of innovations in COVID times with special focus on healthcare. On behalf of the Managing Committee at KMA and all present here, I formally welcome you, Mr. Karthik, to this session of KMA Leader Talks. I also extend a hearty welcome to all the past presidents of KMA present here, members of the Managing Committee and the Executive Committee, Senior Vice President, Joint Secretary, members of KMA and other LMAs, student members, members of the media, and all invited guests to this session which is about to begin. So without further ado, let me invite our Program Committee Chair, Mr. S.R. Nair, or SRM as Karthik was mentioning, to formally introduce the speaker and also take us through this session. For those who still do not know SR or SRN well, he is a senior past president of KMA and is a renowned corporate mentor, business coach, author, blogger, and thinker who turned his focus to academia after a successful stint as an IT entrepreneur for many years. Over to you, SR, to introduce a speaker and to take you through the session, including the Q&A. Thank you so much.
Thank you, President. Thank you very much. Chairman of the session and President of KMA, Madhav, uh, audience which consists of corporate managers, entrepreneurs, businessmen, and students. I would now briefly introduce Mr. Tirupathi Karthik and then hand over the podium to him to do the presentation. He would do so for about 35 to 40 minutes, and then we would get into the questions. And in case any of you have any questions, please put it in the chat board from where I'll pick up, identify you, and ask this question on your behalf. Let me get to introduce Mr. Tirupathi Karthik. Tirupathi Karthik is the Chief Executive Officer of Napier Healthcare Solutions Private Limited, headquartered in Singapore since 2012. A leader in the healthcare IT space, Karthik has extensive business leadership experience across Asia, Middle East, and the USA, particularly in the enterprise software space. One second. He is a passionate advocate for the innovative use of technology that turns IT investments into competitive differentiators for their stakeholders rather than using IT as a pure cost containment initiative. Before joining Napier, he served with emphasis with the HP company as a senior vice president of Asia Pacific and Japan, including India. His other successful stints include regional leadership roles in companies such as SAP and Covisint, which is a joint company of GM, Ford, and D6. As an entrepreneur, that was another stint that he has had. He was a founder and chief executive officer of Nihongo Bashi, speaking Japanese, okay, an investee company of Economic Development Board, Singapore. Karthik is a winner of 2007 Spirit of Enterprise Award, given to honor self-reliant entrepreneurs starting and operating small and medium businesses in Singapore. So let's hear from Karthik about the innovations during COVID times with a specific reference to healthcare. Karthik, all yours. Please go ahead, sir. Please unmute. Yeah, thank you.
Thank you, Mr. Madhav Chandran, and also SR Nair for a nice introduction both to KMA and my own background. Uh, I'm very excited to be amongst all of you with such accomplishments as we were discussing prior to the start of the call. Today, my session is more focused in trying to go through what. Just give me a second, let me share my screen and then we'll be all good to go. Yeah.
The screen
So
is
we've
visible. Yes. Yeah.
Yes. So we've taken the liberty of using your logo. I hope that's okay. Uh, I'd like to talk about, rather not talk about, I'd like to discuss the innovations that are happening in our industry, the healthcare industry. It's a very, not many people would know, it is the most fragmented industry in the world, the healthcare technology world, compared to just the opposite, for example, in the IT world, where the top 4 or 5 players would hold 80% of the market share. Here it is just the other way around. So, in addition to the traditional IT challenges that most industries face, we have another unique challenge, which is how do you make something profitable on a fragmented scale? So that's, I think, keep that in mind as we go through it, and it'll also give you, in addition to that, as we were discussing earlier, the reluctance of healthcare professionals to use technology a lot, fundamentally arising from two concerns. One is that the lives of people are at stake, so they don't want to jump into something that comes the most fanciful one, so you don't find so many early adopters, so to speak, and also a general disregard for technology because they believe that a lot more can be accomplished in a face time with the patient instead. So keep that in mind as we go through this. We call it the Samvad, which is the in the spirit of dialogue. Please do not treat my discussion here as a monologue. I would really love to have an interaction with you. Hopefully, at the end of it, I can learn a little bit, and so can you about healthcare. And I think that's the idea that we want to look at. In terms of the agenda, what two simple points: how do we pandemic proof the world using technology, and how has that technology forced and innovation in an agile manner in healthcare. So I hope to complete this in about 30 minutes and then still have some time hopefully left over for a conversation between us. If you were to reimagine healthcare, I think there are two key trends that actually nothing fanciful like the healthcare industry always has been. We are not known for revolutionary stuff. We are known mostly for evolutionary and incremental innovation. I think what the pandemic has done is it has accelerated the arrival of an interconnected digital health system. It just laid an emphasis on why it ought to be that way. And there was anyway a move out of caring for people out of hospitals, but it is now again accelerated by COVID-19. What do I mean by this? Just imagine if, for those of you who are frequent users of Amazon services, just imagine if Amazon told you that, henceforth all deliveries will be available to you at my warehouse. Please come and collect it, and that would tell you what it means to use a logistics provider. And that is how a lot of the healthcare has been designed for the last few decades, I would say probably centuries, since the modern healthcare system has been put in place. Healthcare has always told its stakeholders, please come to my place to get treated, otherwise too bad, right? And that sets up this issue of access to health. What might surprise a lot of people is India, as an example, does not have a shortage of healthcare professionals. It does not have shortage of money. India, like what the former finance minister once said, I remember very vividly when he came to Singapore, Mr. Chidambaram, he said, India is not a poor country, it's a very rich country with a lot of poor people. In the same manner, India does not have lack of resources. The issue is all those resources are concentrated in but a few large cities, and that creates this new problem of access to health. It's not new or unique to India alone. It is true for all large countries. India just seems to be on a more severe side of that access to healthcare, which is now getting better, and we'll see how that is happening due to the last 24 months. Uh, if you look at the history of pandemics, COVID is actually not even significant. You look at Black Death in the year 1347, about 200 million people. That's the fatality rate. COVID, as you know, is probably about 4 million as it stands today. Even the recent Spanish flu, which is much spoken about, is about 50 million. I'm just trying to, I'm not trying to, play down the deaths. Every death is one too many. But the point is, let's look at the scale of what happened. And when this Black Death happened in the 13th, 14th century, right, the population of the world was probably more closer to 2 or 3 billion. Today, it is more closer to 7.5 billion. So that gives you an idea of the number of fatalities as a percentage of the population. If you look at that, the 4 million actually shrinks to a even lesser importance in that sense. Look at where we stand today. There are 240 million cases that are there, but the deaths are about 4 million globally. Uh, Not very surprisingly, every country, big, small, fat, short, stout, whatever adjectives you can put onto countries, all of them have suffered. Uh, Developed countries have suffered, developing countries have suffered, underdeveloped countries have suffered. I don't want to go through these morbid statistics, but I think what is of heartening statistic is in India, about 21% of the population is fully vaccinated, and close to about 978 million have been, out of the 1.3 billion, have been given at least one shot. A single shot, as we know, does a lot for improving the immune response to the COVID pandemic. So I think just leave it at that. But what it has done is, in India, as much as in every other country, including the US and Europe and Singapore and all of them, it has taught us one thing, that our healthcare response needs to be badly coordinated. It has to be interconnected in a lot better fashion than it is today. Today, it is a mosaic of small healthcare facilities here and there trying to deliver something, but it has to be interconnected a lot more. And we will examine that a little more in the next couple of slides. In response, what have we done as a healthcare technology industry? We have tried to deliver what I call as care anywhere. If you go back to the example we were talking of, today, people, as if you're a consumer in any market, in any country, doesn't matter. What is the first and foremost expectation you have? That the service, the product should be good, the service should be good, and it should be delivered where I am. Why, in the case of healthcare alone, must we therefore expect that people go to hospitals? I think that paradigm is changing now, slowly, little by little. And the next big thing I will talk about AI, AI as an industry and AI in healthcare. Both, by the way, are growing in 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 numbers that we can't simply think of today, and we'll talk a little bit more about that later, right? Uh, we have now patients who are demanding where, when, and how they receive their care, and the result is out already. They want it in the comfort of their homes. They want it outside of the hospital setup, especially for the elderly, because we have something called a hospital acquired infection, and that is something that becomes worse as people go into hospitals over the age of 65 that go there. They get a lot of hospital acquired infection which you can do without. And as a result of this, this is probably data coming from the US, and that's why they're talking of ambulatory surgical centers. But in the US, uh, the ambulatory surgical centers, or ASC as they are called, are facilities that are not within a healthcare facility, but they are more like daycare, day surgery centers where people go for surgery for a couple of hours and get out. Obviously, if someone has been having an episode of urgent care, you will obviously have to go to a hospital, which is where you will need all these urgent care infrastructure that hospitals have. And in the COVID times, we have seen a surge in the utilization of those urgent care facilities as well. The last trend has been an increase and an almost an explosive increase in retail health clinics, more branded ones, very specifically for a certain condition, chronic illnesses, so on and so forth. The interesting thing that Forbes said was starting 2021, every business will now have to have a healthcare component. They obviously dramatized it for and exaggerated it for an effect, saying that every company will have to become a healthcare company. But the fact is, if you have 5,000 employees, you have to take care of 5,000 employees. Otherwise, they are not coming back the following morning to work for you. So every company has been forced to look at COVID insurance, healthcare insurance, mental health. We've been doing a lot of that ourselves in India, where we have a development center and so on. And this now becomes an essential part of our business calculus, which is how do I take care of my employees. So the healthcare agenda becomes a part of the business agenda now, even if you're not in a healthcare sector. Right. What has this done? This value-based centricity in approach to everything that companies do. For patients, what it has done is it has reduced the instances of under and over treatment, which is a good thing. You get better counsel, which means you get educational materials. It's not unusual to see even in India, the moment you finish a consultation, the doctor actually sends you a link saying that read this up about your condition. So that makes a patient a willing stakeholder and a co-passenger in that journey of delivering healthcare, and personalizes it. So that's kind of some of the things that it has done. And from a technology perspective, Care Anywhere today is delivered, in my view, through things like virtual care, remote patient management and monitoring. We'll talk obviously about AI and big data and analytics and so on. Yeah. But what the disruptors have managed to do is to force and convince everyone that simplicity is a must and convenience is, it's no longer table stakes, but it is something more than that. It is the very hygiene condition that requires you to be in the space. If you look at telemedicine, which is what was previously a cornerstone of healthcare, virtual care, look at this funding for just the telemedicine business in the US. It's broken all the records, and in a fourth quarter in a row, you can see how the numbers are jumping up, right? I don't want to read through all the stats. I'm sure you can look at that yourself at a later point in time. I'll leave these slides with you. But telemedicine alone has contributed 27 telehealth unicorns. that must tell us something, that this is probably where the personalization and the intuitive healthcare ecosystems are, congregating to deliver some value to the ultimate stakeholder, which is the patient. So keep this in mind, especially those of you who are, entrepreneurs wanting to go into healthcare. In future, the thought of the healthcare design of systems and facilities will not be restricted only to a hospital. You'll increasingly see care anywhere by design, which means that constraint will be lifted. Uh, Again, another data point for what it is worth. This whole space is likely to be 300 billion by 2028, just the virtual care alone. What is going down, if you can see on the top, I'll just spend a quick minute talking about it, is the reduction and the degrowth in skilled nursing facility and the long-term acute care. The long-term acute care is where, people were pushing, and not in India but in other parts of the world, people were pushing elderly, those that did not have a family support, into long-term acute care facilities called nursing homes. Do not confuse this with the nursing homes in India. This is nursing homes where people stay for 20, 30 years, so on, until end of life, some, and in the end last 1 or 2 years moving into hospice and palliative facilities as well. This is degrowing because now, as you saw earlier, everything is moving to where I live is where I want healthcare, not where you are. And so that's why this degrowth is in and quite consistent with the trend that we have been seeing so far. Uh, like I said, it's not new, but look at the acceleration. It just went like 100 times from one end to the other in terms of the CAGR. Virtual care, again, not wanting to spend a lot of time on this, but it basically provides convenience for the stakeholder. You don't have to get out of the comfort of your homes, and we can do a lot with just physical Wi-Fi availability and a few devices, which I'll probably present a case study in my next slide, and you will see how. For the physician, it's very important because the physician now sees, especially for the elderly, how they are interacting in their environment. It becomes very important because some of the elderly issues, like you have dementia, like you have fall risk, like you have some of the other wandering issues that happen on account of dementia, all this becomes important because the physician is then, the geriatrician is looking at understanding your environment as well. So this is also good from that point of view. Yeah. Uh, I just want to talk about a quick case study that we did in 2017 in Chai Chi in Singapore. It's a community in the eastern suburb. This was sponsored, rather not sponsored, it was funded by the Infocom and Media Development Authority, which is like the IT ministry in Singapore. We recruited about 60 elderly patients for two services. They were all between 45 to less than 80, and they must have had history of blood pressure or diabetes or both. And for the tele rehab, we looked at the people who must have had osteoporosis or osteoarthritis. What we expected was they would take their own blood pressure, glucose level, heart rate, and weight, and we ran it for two 6-month period. And the greatest impact we found was blood glucose and blood pressure could significantly be impacted in terms of outcomes. They could be significantly impacted in that short study of 6 months, where all that people did, we did not give any medication, we didn't do anything, we just got them to take the readings on a daily basis. That in itself, plus a little bit of counseling over the phone, brought their conditions under control. And it was, in my view, a good success, a good pilot. 77% said that they would recommend this to their families. 91% of them said was it was easy to use, and over 95% were highly satisfied with the program. And a lot of them said they would of course like to continue, provided we gave all those blood pressure meter, the glucose, and the heart rate and the weighing scales and all of that for free. We gave them a free Wi-Fi, and if they gave them a free doctor consult, they said they would certainly like to go ahead with this. But in Singapore, as probably some of you might know, nothing ever comes free. So that was where we ended the program. But it was very heartening for us to see that the elderly did not find a barrier to using technology. And this I'm talking 5 years ago. They were making use of smartphones and things like that. So this was the earliest pilot we did of an care anywhere in Singapore. We married the Wi-Fi plus IoT. IoT is the Internet of Things. These are all devices that you see there: the BP, the glucose meter, the heart rate monitor, and the weighing scale. They were all equipped with a Bluetooth device, so that the moment a reading was taken, it connected to the Wi-Fi and transmitted that to a portal that we were manning at our end from a central platform. Moving on to AI, very interesting. For those of you who are old enough to remember the dot-com boom that eventually went bust, I remember in 1994, I sent from, in those days, I used to work for this company called Digital Equipment here, and I sent an email to someone, and within couple of minutes or seconds, I got a response from someone in the US, and it was like, oh my God, what happened? Right? And then, of course, it went into a euphoria where there were a lot of internet businesses that were set up, and there was dog.com, dogfood.com, dogpet.com, and sleeves.com, dogwalker.com. And obviously, when dog.com died as a business, the other also followed suit. But what it left for us is, look at this, a very rich portfolio of companies who run the whole business using internet. In those days, if you just used internet and you could list on the stock exchange saying that I'm an internet business, put an I or an E in front of you, but the only one left from there is eBay today. None of the others are even alive. Why I'm giving you the story is, consider for a moment AI. AI is exactly the same thing. AI is not a business, just like internet was never a business. Internet was a way of doing things. AI is a way of doing things. AI is what I take for a moment. One more point I just want to talk about. In a day, do you say that I'm going to be dumb for 7 working hours of the day, and every morning 9 a.m. to 10 a.m. I'm going to think? Would you ever work in a mode like that? Why then are companies setting up an AI division? This is what I would like to ask all of us. Why do we have to set up an AI division or an AI product? Why cannot I be intelligent throughout? And that is what is my view of AI. We must infuse AI in everything we do. Every feature I build in every product that I deliver, I must have the ability to use AI and deliver intelligence to my stakeholder to make decision making. I will never be able to replace a doctor with an AI box or an Alexa equivalent talking of something, but I can make his life infinitely easier, because, very simple, man cannot build something that he himself doesn't know. So this engine cannot get better than its own creator. So let's keep that in mind, and let's look at AI holistically, just like internet was. Internet is not a business, AI is not a business. AI is a way of doing things, just like internet is a way of doing things. Just look at the market predictions, right? The blue bar represents the healthcare IT services today, and it's growing across the world. It may be highly fragmented, growing nevertheless. The green bar represents the AI market size. At one point in time, the AI market size will overtake the entire healthcare IT services. How is that for a thought? AI is not, if you call it a separate business or if you call it an industry, AI would be an industry bigger than healthcare, so to speak, right? And it would be projected to be in 2028, it would be the number 2 business after banking. Think through some of these things, and it is not inconceivable if you think hard. that this is what will happen. So AI is at a cusp of a revolution, and only those who don't want to be a part of it would not do anything about it today. What are we doing? Just to give you a flavor of what we're doing, I think Mr. Madhav Chandran did mention some of these. Uh, fault detection is a very, very important thing for the elder care. In elder care, fault detection heralds the beginning of their problems throughout for an elderly. You have a fall, then you break a bone, and that results in something. You are forced to visit the hospital. You might pick up an infection from there, which will worsen the chronic conditions and so on. So fault detection is very simple. We can look at all the data and provide a fault detection. Similarly, automated self-diagnosis and subsequent prescription, especially for GP visits. GP visits are fairly common. They will ask you a few questions, and especially if you go to some of the more crowded facilities, as the patient in walking in, the doctor is starting to write a prescription because they know what this guy is coming for, right? So if that can be done, then why can't we automate it? And today there is a business in our industry which is automating that, and AIA, which is a very respectable insurance company globally, actually funds them and is an investor in that business, right? We can similarly do early detection of stroke, of sepsis, of fall risk, and so on and so forth. The first case was fall detection. The second one is fall risk. So, if you're wondering what is both seem similar, so what is the difference, right? So we can do some of these today. Personalized medication and care. I know, for example, in oncology practices where there is a patient, they actually do a DNA analysis to see which of the treatments will best suit them, and that's how personalized medicines and care is now coming through, and it's not going to be long before this filters in through the other practices as well. We can also do wandering, especially for dementia. If elderly are wandering away somewhere, you can do a lot with IoT and AI based detection, and bring relief to them. uh, there is also the concept of edge in AI. So there is AI, there is edge, which is IoT devices. At that point itself, if I can bring in some AI, then I greatly improve the effectiveness of AI that we look at. Won't talk too much about it, but if you're interested, we can have a chat. This brings up my last slide. There are issues of quality and challenges, but no greater issue in healthcare than accessibility. So, if you are looking to solve some healthcare problems, pay attention to accessibility for the entrepreneurs there, for the management there. If you're running businesses, pay attention to healthcare of your employees. That is what will become a big, you know, uh, choice making factor for them as they want to join your organization. Uh, my suggestion is, let's incorporate technology and walk towards a convergent healthcare system where healthcare becomes a part of what we do every day. Actually, it's not healthcare, it should be wellness, if you use the right term. We are looking to make everyone a well being individual, not take care of them after their health has been impacted. With that, thank you very much for a patient hearing, and be happy to take any questions that if you have. Thank you.
Karthik, just stop the screen share so that we can get the complete calendar view. That's
Sure.
very good. Nice, thank you. Yeah. While I will be receiving questions from the audience here, I will engage with you some questions and therefore thereafter take it from the Karthik. Thank you
Sure.
very much for a very crisp and at the same time a lot of data point oriented presentation related to healthcare. And I have been enamored by by your findings on healthcare on the elderly, and you also ended by saying about the fall, which is actually an attribute of the elderly. They fall and then thereafter they get into challenges themselves. I would start with asking you this question on retail, the evolution of retail health clinic. Earlier we have had this GP thing, and thereafter then went into specialization, and people started going to hospitals and healthcare facilities, and then now you say that evolving into a retail health clinics. Okay, so would you be able to show some more light on this retail health clinics? I understand that this is all very prevalent in places like Singapore, etc. But will it be in pole position if you really look at it in countries like India?
Sorry, I lost you towards the end. What is
Yeah.
the question? Will it?
I was asking you in places like Singapore, etc., developed places where I had seen this retail health clinic proliferating, but will it be as successful in place like India? That's what the question
Yeah.
is.
Uh, I think before I answer that question, let me bring back one data point which I probably missed mentioning. India, not India, Asia as a whole will have 1.3 billion elderly people by
Yep.
2045. If you look at that number, 440 million of that will come out of China, thanks to their one child policy, where the pyramid has now gotten inverted. One earning member is supporting between 6 to 7 non earning people. Uh, and you would think India is probably not going to go through that problem, and we're fine. But India has about 180 million people in that number. In that number, I think it is 220. But India, as of now, from what I understand, is close to about 80 million people over that age.
Okay.
Uh, if you examine what happens to an individual after the age of 60 or 65, which is the onset of chronic illnesses. These illnesses come in many forms and shape. You could look at the diabetes, the heart, blood pressure. You could look at asthma. You could look at osteoporosis, arthritis, and so on and so forth. But what is worse is probably a confluence of all these in the same person, which is what we call as comorbidities. As this becomes more and more prevalent in the population, and you're right, Singapore has a lot more retail clinics. That's because as of today, about 18%, if I'm not wrong, of our population is over the age of 65, right? And that number is going up every other day, as is our longevity. In 1960s, when we became independent, I think our longevity was more like early 60s or mid 60s. Today it is 85. Every 5 years we are adding one more year to that. So with all of this, the chronic disease burden will actually move the businesses and the population towards seeking for specific ailments, and that is how the retail health clinics are coming up. In addition, there are also others like sports injuries and mental health, which is not there previously, but now is also coming up. So this is what is driving the evolution of these retail health chains. In the US, it's been there for the longest time, and I think India will see that very soon. If not now, probably in another 5, 10 years. But it is coming. It already is there. It will become more common and more prevalent. Sorry, that was a long answer to a short question.
No problem. We also enjoy long answers. No issues. Karthik, the second question that I have is related to telemedicine. You know, as you rightly said that it is growing very high. The unicorns on telemedicines are also very high. You mentioned about 27 telehealth unicorns. Where are they? Are they in the developed nations? Or you also see some of them in India?
No, I think the telehealth unicorns are not in India. They're mostly in the US.
Okay.
That's what I have seen. I can get you the data for that, but they're mostly in the US. What accelerated them in the last 12 to 24 months, if you go to that slide, you'll see a lot of M&A activity happened.
Yeah.
Is CMS, which is the Center for Medicaid Services in the US, uh, and they never authorized the insurances to reimburse for teleconsults. But when COVID hit them, there was no choice, and that led to an explosion in the telehealth services. And some of the biggest beneficiaries of that telehealth were the mental and behavioral health clinics and companies that focused on those solutions, and as were some of the others. But I think that's what brought them there. And today, if you see, there's intense mergers and acquisition activity going on in the US in the telemedicine space. The last I heard was one company bought another one over for about $800 million.
Why?
I think the revenue was nothing great to talk about. The revenue was like 30 or 40 million, and they were in perennial losses for 5 years before that, with no hope of returning any money to the investor because they had consumed 200 million in investment.
Yeah, Karthik, that also was the case of Amazon when during its infancy. So, I mean, we would definitely see the app start happening maybe after 10 years or so. Now, this question is about, uh, this telemedicine is all about going to the protocols. You have seen the stroke telemedicine, heart-oriented telemedicine, and of course, you said about mental consulting or therapies that is happening in telemedicine. At one end, we see that you are able to, if there is a good bonding between the doctor and the patient, and this normally happens between one-on-one. And how can it be simplified to a virtual system of one-on-one that is happening? Are you seeing this being accepted and this is growing?
So let me split that into two scenarios. One is for a casual consultation. For a casual consultation, you would, if let's say I got a rash here, I want to show someone and I'm worried about or something like that, it may be acceptable to go to some doctor that you do not know of. But what telemedicine will force is every physician to offer a telemedicine call to their community of people that they look after. So this is not telemedicine, as you know, I'm going to leave aside my existing set of physicians and I'm only going to look at and this is not a license. Let me put it this way: this is not a license to go to any doctor in the country and just turn up. I think there is that element of trust, but more importantly, for example, uh, when you go to some of these countries, I remember my one of my earliest visits to Japan, and in those days I was a vegetarian, and they said, "Oh, you are a vegetarian, very good. So you please go and have fish soup." So I said, yeah, sure, But if you do not know that vegetarian and Indian means this, then you'll have a problem. So you have to put it in that cultural context. For example, you cannot go and tell someone from the south saying that you eat four parathas every day. The fellow probably won't even know what you're talking about, right? I'm just exaggerating to make that point similarly. So the cultural what do you say, the cultural understanding of the patient, their background is very important, which means you may at best go out of your district to the neighboring district or within the state, but it is unlikely you will want to go out and talk to some doctor in the middle of the desert in Rajasthan, for example. So it's not going to change that way. But what it will force is all the doctors to offer telemedicine, right? So it's not going to turn everything on its head, but it will just force a gentle change in pace and the way people do things.
The experience of India in COVID and telemedicine, while that has been there specifically related to COVID, I think in other areas, the telemedicine, there wasn't much of improvement between patient and doctor telemedicine interactions. And that's what I understand. What's your view on this?
Sorry, could you repeat the question again? In other areas?
uh, as related to telemedicine application in India, in the area of COVID as a disease, there had been telemedicine consulting, etc., going on. But in other areas, other diseases, etc., there has not been much of traction between the doctor and the patient on telemedicine. That is, the telemedicine did not really catch up to that extent. What is your view on this? That's what I was asking.
No, I think telemedicine is very useful if you look at what we call as post discharge care.
Yeah,
In post discharge care, do you want someone who's already immunocompromised to come into the hospital again for a visit? You probably don't want.
yeah.
And I have already met you as a patient, for example. So do I mind looking at you and talking to you over the phone? I don't, or over the wire. I don't. And then if I still believe that at the end there is some amount of residual concern, I do want to see you, then I might actually ask you to come over.
Yeah,
Or nowadays there is a new paradigm even there. You have home care visits.
yeah,
So home care visits can be done very easily. So previously, especially if you take diabetic patients for either foot screening or for wound dressing or for some of these things, they needed to go to a facility. No longer. Now that facility can come home, and you don't need a doctor. You can actually make do with a nurse or a nurse aide as well, and that can take care of it. So things are changing. That kind of brings us back to that care anywhere discussion that we had.
a scenario like India, where still lots of our population live in urban, rural setup, with limited access to technology, etc. Do you think that proliferation can happen in a faster pace, or do you think it would take time in countries like India and similar to that?
So I would like to take us back to the era of Unix versus the mainframe. India blissfully, I remember, bypassed the Unix, the mainframe wave because we didn't even know what we didn't know, right? In the same manner, a lot of communities in rural India, and for that matter, any large country, rural country. I have been to rural communities in the US where there's 2,000 people in a small town, and we were trying to implement a software in the hospital that they had, and they are no different from the rural people in India. It's just that they just look different, and they wear and groom themselves differently. They wear different kind of clothes for that season. That's about the only difference. But the communities in remote regions, rural communities, are pretty much the same. They don't have internet. They are quite hardy people, and they don't believe anything is wrong with them until they're completely laid to waste in a bed, and that's when they think, oh, something happened to me, right? So that's because healthcare is very patchy even in developed countries, in rural places, and India is no different. But what has changed is, you look at 3G or 4G today, almost everybody has a phone, and we are actually working on technologies where I can deliver a teleconsult over a 125 kbps line, for example. That's the video transmission rate that we are looking at. We are working with the university here in Singapore to see if we can achieve that. And if you can deliver that, it will be fantastic. I remember in 2001 or 2, it was when the then president, Dr. APJ Abdul Kalam, came to our office, because in those days we launched telemedicine with a hospital in Hyderabad, and we used some of the technologies, a video server technology that was used in the space labs. And if you recollect, he was a big champion of bringing space technologies for domestic and other industry users, and
Yeah,
that's
yes.
what we did. So if you do all of that, India is a great place. It's a jugaad nation, if you will, right? Necessity is the mother of invention. If you have no resources, how do you still make something out of it? And if you can look at all of that, we will leapfrog the need for building healthcare facilities in rural community. Telemedicine, I want to argue, is one such technology.
Yeah, I'll go with you that because that is the need of the hour. But the only thing is how the application is being accepted by the folks and how it is being implemented. I have very by the case study that you have done, okay, and finding that BP and blood glucose level, there had been remedies that is happening or things were not going up, and uh, that has been a good revelation. That means by simply even monitoring and giving some counseling, things are improving, isn't it?
Yep.
So now there is the other, on the other side. Now I see a lot of millennials actually doing self medication by through the Google University. So
Yes.
how do you compare these two together?
I think the Dr. Google. So there is some of my doctor friends say they most of the patients come to them for a second opinion. The first opinion has already been delivered by Dr. Google,
Yes.
right? So your second opinion is what they come to you for. I think it is very dangerous. We would obviously discourage all of that. Uh, Having said that, Google is a good medium for patient education. We call it the CEI, or the continuing education, and that's a very good source to understand once you've been diagnosed and that
Yeah.
has been confirmed. But I don't think people should be doing self-medication. It's good if you want to do self-medication for your headache or pain or something that is there for a day or two. That is fine, but not on a. In fact, no one knows what could be if you have a swelling in the arm. You don't know whether it is because of something very minor or it is something major. So uh, I don't think we would want to advise anyone to do this. Uh, and if you go back to the example, I think that's probably where your question is coming from. There is an AI chatbot that is available. It has used about $100 million of investments and about 2,000 odd PhD nursing and medicine professionals, and they have built every conceivable what we call as a clinical pathway in that chatbot. So the moment you present a question, it will then guide you through a series of a complex tree of decision making and then give you a suggestion saying that this is what it is. I have personally been in that session, that kind of a discussion, and there are sometimes if you present completely irrelevant symptoms, they'll say you should see a doctor first, and that's how it
So
would end.
that again actually shows up the inefficacy of artificial intelligence, about which you also spoke, isn't it? See, I also tend to believe that recently I was reading this book called "In Defense of Human Being" by Dr. Thomas Watt, in which he says artificial intelligence, without the statistics and data points and analytics and automation, etc., that you can build in, but so long as you cannot build in human consciousness into artificial intelligence, and that differentiation will always stay there, isn't it?
Yeah. So human consciousness is very interestingly, neuroscience does not recognize consciousness, by the way. If you are
Yeah.
spiritually inclined, because I heard you use the term consciousness, uh, neuroscience does not recognize that. They believe the brain creates cognition, and that is what is all that about. But I think the consciousness is something that we all intrinsically possess. I firmly believe that we have not understood consciousness, and therefore it is going to be very difficult for us to create an AI solution that surpasses our own understanding of things that matter. So it is unlikely that we will create something that goes beyond our own imagination. Sorry, beyond our own knowledge, not imagination.
You are an
Imagination.
IT man as well as you're a medical healthcare person, and you said that actually brain sciences does not accept the human consciousness. So, what's your personal opinion about this, Karthik?
You're taking me into a subject I didn't prepare for. But my own view is consciousness is, I don't want to get spiritual on this, but consciousness is very, very different, very powerful, and that is what decides and dictates a lot of moral choices that one makes. And that uh, will fail a machine, especially if you are at a point where you have to decide between keeping life and letting it ebb away. And I think those kind of moral decisions very hard to make. And you have the classical autonomous vehicle puzzle that they ask. If it's a autonomous vehicle that's on a bend and it is carrying 50 kids in the school bus, and there are two people walking on the road, if I do a little, those two will fall off the cliff. If I don't get it right, these 50 will go. Now who do you choose? Right? And those kind of decisions are not meant for uh,
Yeah.
machines, in my view. That's something that only a human being can decide.
Thank you, Karthik. I have stopped asking my questions. I have a question here from Suresh Kumar TK on the chat box. It says,
Sure.
who will monitor or ensure that the retail health clinics are adhering to human ethics so that the patients are safe and satisfied? Health Department of Government or any other better solution in Singapore, which could be emulated in India, the highly populated nation? That is his question.
I, uh, I think these kind of questions stem from a general perception, I would say a bad or wrong perception of medical professionals in some countries and in some communities. I would like to say, in defense of doctors, 99.9% of the people I have met are some of the finest individuals I have ever come across. They take the Hippocratic oath to defend a life and do everything possible, including laying their own lives, and that's what they do during the times of COVID. Now, if I can come back to the point that was raised in the question, which is how does one ensure regulation? That's a very good question. So today, if you look at it, most countries have regulation based on licensing. What that means is every doctor, I think in India, they have to register with the Indian Medical Council, if I'm not mistaken, and their license has to be renewed for practice in the country. And if there is a little bit of doubt that they're not doing the right thing, then obviously, you can take their license away in extreme cases. But talking of telemedicine specifically, because telemedicine is a very unique development and recent one, almost every government, and including Government of India, have released telemedicine guidelines. What can be done, what cannot be done, what must be done, and what must not be done as well. Not I would not say they have gone to the extent of what some of the other countries have done, but I think they have left some bit to the flexibility of the practitioner. At the end of the day, let's all remember and believe in it. And I think this is very important. Otherwise, this lack of belief will destroy the healthcare system. We have to believe, and we have to give it to the goodness of the heart of the practitioner that they will look after you and look after you well.
I think well said. But then I have this last parting question: is that healthcare, is it a business or a human welfare service?
I would say it's a human welfare service. I would not. I have see we have operations in 9 countries. I have come across lots of providers, elder care facilities, nursing homes, taking care of terminally ill patients, and acute care facilities. I'm yet to come across someone who says, "Let me kill the patient and make money." I have not come across anyone. I would never ever go to the extent of saying that, because there might be, like in every profession, there might be one or two black sheep, but doing this kind of broad brush on everyone else, I think would be manifestly unfair for the kind of services that they have been delivering. That's just my personal view.
Thank you, Karthik. Thank you so very much, and thank you, Karthik. As if you do kindly send me the deck, I would have it sent to you, because I already received on my mobile 3 or 4 requests asking for the copy of
Sure,
your presentation. So I would be grateful
sure.
if you could send one. Thank you so very much. We are meeting after a long time. Okay,
Yes,
there has
indeed.
been some internet or messaging that has been going around in the other group that I had seen. I'm so happy that you are well settled in Singapore and taking care of a very important business segment as healthcare is. Here is wishing you all the very best, and hopefully we'll see you very soon. And I will take you back to our president, Madhav Chintan, to conclude the ceremony. Madhav, all yours.
Thank you, sir, and thank you, Karthik, for that very lucid presentation and that very lively chat which you had with SRN. As you promised, you didn't focus much on the technology part, even though you are a tech man, but made the point very clear about the perpetual coexistence of technology and health science or healthcare, and that AI and IoT and big data and data analytics all are here to stay, and healthcare for that matter, even for a day-to-day life that needs to employ technology and most importantly AI in all that we do. You drove that point very straight into the core actually, and subtle reminder of the concerns of a geriatric India, or as we had mentioned KMA about a fast aging Kerala in one of our sessions recently. It's a real matter of concern, and our eyes and focus have to be straight on that elderly care or the long term care that you mentioned. And that's one area where technology has to be very effectively used. I mean, it's a very good alarm call which you have made now, and we need to really focus on that. We are all there for specialized care and medical care and all, but then we are fast aging, 84 becoming 85, 85 becoming 86. Good to hear that, but then concerns are really large. Really a good session, Karthik. We all really got a lot of takeaways from that, and a lot of people who were there were not very commonly found in KMA session. I could see many names out there from the medical side as well as from the medical technology side. I can see some names there. I'm sure they all must have had a wonderful session. Before I pass it on to our joint secretary for the formal vote of thanks, let me just mention a couple of announcements for our delegates who are present here. We have the next session, which is from our Women Managers Forum, coming up on the 25th of October, where we have Mr. Dimant Parekh, founder and CEO of the Better India and the Better Academy, going to be in a conversation with Ms. Meera Haridas, our own Women Managers Forum member and director of Verkener Business Associates, going to discuss on a topic, building a better India. It's all about positivity. So let's listen to that on 25th of October. And the big ticket event of the month, which is LEAD, the leadership seminar in association with the Rotary International, going to be held on 30th October in the evening, where we have Dr. R.A. Mashelkar, Padma Vibhushan Mashilkar, former Director General of the Council of Scientific and Industrial Research, or the CSIR man, who was actually a Padma Vibhushan, Padma Bhushan, and Padma Shri, and has 44 doctorates from multiple universities worldwide. And the only individual who is a scientist who was awarded the G.R.D. Tata Corporate Leadership Award by All India Management Association. He is going to address us, and thereafter we have the world-renowned magician and the inspirational speaker and an exceptional storyteller, Mr. Gopinath Mudukad, taking a session on leadership development called M Cube, or Molding Minds Magically. Interesting session interspersed with magic and storytelling, and a rare chance to see Mudugad in action. There are other celebrated speakers from the Rotary leadership as well, and this is going to be a hybrid meeting with personal and online attendance made possible. That's on 30th of October at Radisson Blue is where the physical meeting is going to happen, because we have got Mudugad and a few other leaders coming in to address us, but then limitation of numbers are there, so first come first serve, there could be a limited number of seats available there. So it's on 30th of October in the evening at 5 p.m. So please stay tuned to our announcements and notices on WhatsApp, email, SMS, or whatever you get for these events and more. So once again, thank you, Karthik, and thank you, SR, for that great session. Over to our Joint Secretary, Mr. Algiers Khalid, for the formal vote of thanks. Algiers, over to you.
President Madhav Chandran, our invited speaker of the day, Mr. Tirupathi Karthik, CEO Napier Healthcare Solutions, Program Coordinator, Past President SR Nair, galaxy of past presidents of KMA and Managing Committee and KMA members. Thank you, Mr. Tirupathi Karthik, for sparing your valuable time to be here today at KMA and for sharing thoughts on innovations in COVID times with special focus on a highly fragmented healthcare industry. Very happy to know all about the pandemic proofing of the world with an interconnected healthcare system. It was music to my ears to hear about the virtual care, especially where I live is where I want, not where you are. Very important for me, who is staying with elderly parents in their 90s. Great to know that access to healthcare is shifting out of hospitals. Care anywhere, especially out of hospitals, at the comfort of homes, is a great thing in our part of the world, where one sees long queues outside clinics for appointments and elderly hesitating to visiting hospitals in COVID times. It was equally great to know about the proliferation of retail health clinics. In fact, I'm seeing that already in Kerala. Healthcare becoming part of business for every company, and the fact that today we have 27 telehealth unicorns valued at 55 billion was an eye-opener. And then all about growing AI as a way of doing healthcare business. Fascinating to know healthcare providers will infuse artificial intelligence everything we do and also look at it holistically. Also to know that AI will overtake the entire healthcare industry to become the second to that of the banking industry. I'm sure everyone thoroughly enjoyed the session. Today's talk was yet another excellent session in KMA's Leader Talk session series, where all members get opportunity to listen to leaders in different spheres of life on speakers' valuable experiences. As President mentioned in his introductory remark, today's session is the 19th in the Leader Talk started this year under the leadership of past President SR Nair. We highly appreciate and are thankful to the moderator of the session, our own past President and Program Committee Chair, SRN, according to Karthik, and SR for everyone in KMA. I don't know why we are frugal in the alphabets. Thank you, past President SR Nair, for arranging yet another current and interesting and relevant topic, and also an expert and valuable speaker from the healthcare industry. Leader Talk sessions have become an event which everyone in KMA eagerly look forward to. Thanks to all the past presidents, managing committee, and KMA members for attending in large numbers today. We had good attendance throughout the session in spite of the scare of flood in different parts of Kerala. I would also like to place on record and thank the KMA Secretariat team led by our Executive Director, Lieutenant Jojo Jacob, and his team members Preejit and Padma Kumar. Thank you all. Also thanks to our program sponsors, Medivision, Hale, Sira, and Varma Homes. They all play a very important role in the success of all the programs of KMA. Before I conclude, request President Madhav Chandran to hand over the specially curated memento to the speaker.
Madhav, please unmute.
For you
Madhav,
to
unmute. Madhav, unmute.
Well, this is a seen online, but it's a physical memento of a proof of you talking here at KMA today. This will somehow reach you very soon. We'll send it across to you.
I hope you will cherish the when you receive it, and you'll cherish it for long of your talk today at KMA. Thank you, one and all. Have a nice evening.
Thank you very much. I'm really honored to have been able to speak to all of you. I think so many of you gave your time listening to some of my thoughts. It's indeed my honor. And of course, for the wonderful memento, this is the first time I'm seeing it. And I look forward to receiving it as well. Wonderful memories again. Thank you very much. Best wishes to all of you and your families in the flood situation that you currently have there, and even otherwise. Please stay safe. My best wishes to all of you.
Thank you.
Thank you so much,
Karthik.
Karthik. Thank you,
It's
Aljas, for
almost
the vote of
9:30,
thanks.
9:45 here. Yeah. Sorry.
Thank you
Sorry
so
for
much.
deviating.
Thank you so much, Aljas, for that nice vote of thanks, and thank you, Karthik, once again for being with us and all your nice time and nice words you shared with us. Thank you so much, and all of you stay safe and good night from KMA.
Bye.
Thank you.
Thank you very much.
Thank you.